Imagine waking into a hospital where your doctor isn't human. Instead, an AI scans your systems, diagnoses your condition in seconds, and prescribes the perfect treatment, all without a single human touch. But can AI really replace human doctors? Or will medicine always need the empathy, intuition, and experience that only humans can provide? Welcome to 01 Human, where we'll try to find out how much will AI revolutionize healthcare and will human doctors still have the final say. So stay tuned and let's find out. So let me begin by asking you a question. Have you ever thought how many diseases go undiagnosed just because the signs are too subtle for even the best doctors to catch? You would be surprised by that number. But now this is where AI comes in. It's totally changing the game in medical diagnostics. Think about it, AI can detect patterns in seconds that might take humans hours to analyze. It can detect the tiniest anomalies in X-rays, MRIs, and CT scans, things that even experienced doctors might miss. And here's a mind-blowing fact. AI-assisted breast cancer detection has reduced false negatives by 9% and false positive by 5%, which basically means fewer missed cases and fewer unnecessary scares for the patients, which definitely is a big deal. Now, this is obviously not about making the doctor's job easier. It's about catching the diseases earlier, treating them faster, and ultimately saving lives. But does this mean that AI is ready to replace human doctors entirely? Well, not so fast. Let's first try to find out how much AI is already in the medical field before reaching to conclusions. We're talking about a world where surgeries are safer, more precise, and come with fewer complications. Well, that world is already here, thanks to AI-driven robotic surgery. Meet the Da Vinci surgical system, one of the most advanced robotic-assisted surgery platforms in the world. It allows surgeons to perform minimally invasive procedures with incredible precision, using robotic arms that can make movements far steadier than human hands ever could. That means fewer mistakes, less damage to the healthy tissue, and faster recovery for the patients. And we all know that speed matters. AI-assisted surgeries reduce operation times, which means less time under anesthesia, lower risks of complications, and shorter hospital stays. Now that's a win for both doctors and patients. That's definitely a huge leap forward in patients' treatment and safety. Now let's talk about virtual AI doctors, a healthcare system that is available anytime, anywhere. Imagine that it's late in the night and you're feeling sick and there's no doctor available. What do you do instead of waiting for hours or even days for an appointment? Imagine getting a medical consultation right from your phone. These AI chatbots are available 24/7, ready to analyze symptoms, provide basic diagnose, and even suggest treatments, all without ever stepping into a clinic. And they're not just for common colds. These AI systems help monitor chronic conditions, track patient data, and even prescribe medications in some cases. But where this technology really shines is in the rural and underserved areas, where the doctors are scarce. Instead of traveling hours to the nearest clinic, people can access medical advice instantly, potentially catching health issues before they become serious. There are so many AI-powered healthcare systems already coming up, and they are already improving access in over 90 countries, helping millions get the medical attention they need anytime, anywhere. Now, of course, AI chatbots aren't perfect. They can't physically examine you, perform tests, or provide the human reassurance that a real doctor can. But then isn't it better than no doctor at all? Especially when you talk about places that do have internet but not a clinic in 100 kilometers radius. Okay, so we all know that AI is already mastering the technology that humans created, or let's say it is already getting ahead of us in most parts. But what if now AI starts making new discoveries and innovations like the humans have been doing for centuries? With the help of AI, we could probably find life-saving drugs in a matter of weeks, if not years. Traditional drug discovery is painstakingly slow. Researchers have to go through millions of chemical compounds, conduct endless trials, and navigate years of testing. But AI, it can analyze millions of potential drugs in a fraction of the time, predicting which ones will work with pinpoint accuracy. AI has already designed a brand new antibiotic that can fight antibiotic-resistant bacteria. This is a huge deal because antibiotic resistance is one of the biggest threats to global health. The discovery of an AI-designed antibiotic was first reported in 2020 when researchers at MIT used AI to discover helicin, a powerful antibiotic capable of killing antibiotic-resistant bacteria. AI has also helped cut the development time of COVID-19 vaccines, and that's a massive acceleration in a fight against diseases. But it doesn't stop there. AI is paving the way for personalized medicine, where treatments are tailored specifically to your DNA. So instead of a one-size-fits-all approach, AI can analyze your genetic makeup and create a treatment plan customized for your body. Imagine somewhere in the near future where doctors don't just prescribe medicine based on averages, but instead based on exactly what your body needs. Fewer side effects, better results, and medicine that actually works for you. Now, there is a lot of data that supports the fact that AI can diagnose diseases with incredible accuracy and assist in surgeries with unmatched precision. But then there is something about the human doctors that AI cannot match. When it comes to human connection, AI definitely falls short. There is no human empathy, no reassurance, no motivation, just pure cold advices and procedures. Imagine someone being told that they have cancer, not by a compassionate doctor who listens to you and supports you, but by a machine-generated response on a screen. No warmth, no empathy, just data. This is one of AI's biggest limitations. Doctors don't just diagnose, they comfort, guide, and make tough ethical decisions that a machine simply cannot. See, for a lot of people, this might not make a lot of sense, which is totally understandable. But then there is another major issue that might make these people think twice before relying on the coded doctors: the bias in AI. See, AI learns from past medical data, but if that data is flawed or lacks diversity, then AI can make biased decisions, potentially leading to misdiagnosis or unequal treatment. Okay, so let's talk about jobs now. What's going to happen to them? Some people fear that as AI becomes more advanced, human doctors could be replaced, leading to massive job losses in healthcare. But while AI can handle repetitive tasks, it still cannot replace human expertise, ethical reasoning, or the trust that comes with doctor-patient relationships. So I still believe that instead of AI replacing the doctors, the future of healthcare might look more like a powerful partnership, where AI enhances medical care while humans provide the judgment, ethics, and emotional intelligence that machines simply cannot. Now, AI isn't just transforming how we diagnose and treat patients, it's also revolutionizing medical education. Medical students used to rely mostly on textbooks, lectures, and limited hands-on training. But now, with the help of AI and augmented reality simulations, they can practice surgeries in a completely risk-free environment. Students are performing complex heart surgeries on a virtual patient where every movement is tracked, analyzed, and improved by AI. And it's not just for beginners. AI-powered learning systems help even experienced doctors stay ahead. Medicine is constantly evolving, with new treatments, techniques, and research emerging every day. AI-driven platforms can analyze thousands of medical studies in seconds and provide personalized recommendations to doctors based on their specialty and patient needs. Robotic training assistants are also changing the way surgeons hone their skills. Before performing real procedures, they can practice on AI-driven robotic models, perfecting their techniques with real-time feedback. This means better prepared doctors, fewer surgical errors, and improved patient safety. So maybe the AI isn't really replacing human expertise, but actually enhancing it, making sure the next generation of doctors is more skilled, more knowledgeable, and better prepared than ever before. But as AI continues to integrate into healthcare, one big question remains: how do we balance technology with human care to create the best possible future for medicine? I guess only time will tell. One thing you should remember is that AI in healthcare relies on huge amounts of patient data to improve diagnosis, treatment, and research. But with that comes a serious risk: how to keep this sensitive information safe. Patient records contain everything from medical history to genetic data, and if that information falls into wrong hands, the consequences can be devastating. Cyber criminals are already targeting AI-driven healthcare systems, looking for weak spots to exploit. And here's a shocking example. In 2024, a cyber attack on a US hospital AI system compromised 1.5 million patient records. That's personal medical information exposed, putting patients at risk of identity theft, insurance frauds, and even manipulated medical records. So while AI is transforming healthcare, data security needs to evolve just as fast. If we don't stay ahead of the risks, the very technology designed to save lives could become a serious threat to patient privacy. Anytime in the near future, AI most probably won't replace the doctors, but will definitely act as an assistant, handling data-heavy tasks while doctors focus on the patient care. AI is already projected to automate 30% of medical tasks by 2035, allowing doctors more time for direct patient care. This brings us to the end of today's video, and I'll just say that the future of medicine is not about AI replacing doctors, but about AI augmenting their capabilities. While AI brings unparalleled accuracy, efficiency, and innovation, human doctors remain irreplaceable for ethical judgment, empathy, and complex decision making. The ideal future is human AI partnership where technology empowers doctors rather than replacing them. I hope you enjoyed the video and are equally excited to witness the future that AI brings for all of us. Thanks for watching, stay safe, and God bless.